Hello, everyone. This is Rose Horowitz. I am a Pulitzer-nominated journalist and founder of Women to Follow. And welcome, everyone, to join us today. I'm honored to host. This is episode 21 of my Women to Follow show with my amazing guest, Dr. Camille Clare. She is the chair of the Department of Obstetrics and Gynecology at SUNY Downstate. And we're going to meet her really shortly. Want to give a shout out to my great producer, Stefan Kaplan, who's Spin It Social on Twitter, and want to thank the sponsor for my show, Women in Technology International, or WITI, which is one of the biggest networks for women in tech. I invite you to join us. We're live on Facebook, on Twitter, on LinkedIn, and YouTube. And I want you to think about what questions you have for me and my guest about women's health care and abortion rights. I'd love to hear from you. And you can post your questions on Facebook, LinkedIn, and YouTube. Just to really recap, because it's been in the news, that there's lots of news. Last month, the Supreme Court reversed Roe versus Wade, ending 50 years of the constitutional right to an abortion in America. And as we know, I think about a dozen states have banned or restricted the procedure. As that is happening, abortion rights groups have tried to block new bans with the argument that they are vague or violate state constitutions, or to prevent old bans from going into effect that they argue are antiquated. You know, they sometimes date back 30, 50 years or more than that. So just a little background about my guest. She was appointed chair of the department at SUNY Downstate, which the full name is SUNY Downstate Health Sciences University, a public medical school and hospital in Brooklyn. She's a professor at the College of Medicine and School of Public Health. She received her medical degree from Albert Einstein College of Medicine and completed her obstetrics and gynecology residency at the State University of New York at Buffalo. She earned a Master's of Public Health in Health Policy and Management degree from New York Medical College. She's received many awards for her medical teaching, student teaching, and we'll talk about that a little later. She is also an active member of the American College of Obstetricians and Gynecologists, and she currently serves as chair of the group's District 2. But she'll be speaking today as in her role as an OBGYN and not as the head of the District 2. Dr. Clare. Hi, Dr. Clare.
Hey, Rose. Thanks for having me. I'm so excited to be here.
Thank you so much for joining me. I get to see you again this way because during the pandemic, you were a guest on She's on Call, hosted by Dr. Sujana Chandrasekhar and Dr. Marina Korean. And I was a producer. So I got to know many brilliant doctors like yourself. So it's an honor for you to have you.
Thank you.
And just start off, how are you today? How are you tonight?
I'm great. I'm excited to talk to everybody and really give my perspectives and talk to you a little bit about what I do and where we are in this world as an obstetrician gynecologist. I'm super excited about that.
Thank you. Let me just start asking you with a positive question in this time of turmoil. But you know, what are some of your favorite things about being an OBGYN and chair of the department at SUNY Downstate?
Yeah, I mean, there's so many. I mean, now it's hard to think about things in a positive light, but no matter what, I chose my specialty for a reason. I really wanted to have the special relationship with my patients. It's a unique one compared to other fields of medicine. We're with our patients through many happy times in their lives for a lifetime. And so I really enjoyed that. I also enjoy as being a chair and being a person as on faculty. I really love teaching the next generation of OBGYNs. medical students who are excited about the field or deciding about whether they want to join the field. I'm excited about training future doctors, so residents and those in fellowship. And I'm excited about how I can support faculty members in their career goals in academia or whatever they wish to do. So I think as a chair of a department in particular, that's really the impact that we have to continue to mentor others to hopefully do what I do in my life if they so choose.
That's awesome. That very, I think all of us, just like we remember our teachers for women, I think we always remember our OBGYNs.
Yeah.
And it is partly that, such an important and close relationship. And I hadn't thought about that as, comparing that to other doctors, I see and have had. So
Absolutely.
Interesting. And teaching is so important.
Absolutely.
So, thank you.
Welcome.
And, one of the challenge, what are some of the biggest challenges in being, I guess we'll leave out the OBGYN right now with everything going on with Roe, but what are some of the biggest challenges in being a chair of a department at such a big, a big public medical facility?
I had the good fortune of being recruited here to SUNY Downstate in Brooklyn, which serves about 2.3 or 2.6 million individuals in central Brooklyn. So a huge, huge borough. So that's super exciting. It's exciting to be able to, provide a legacy. This department has a long legacy of providing care in this area. It's one of the oldest OBGYN departments in the country. And so it's really, I'm really excited about being a part of that legacy. And also in terms of challenges, I think, being aware of that legacy, trying to create my own, trying to impact what I wish to in the field is what I'm continuing to learn how to do. And I think, but on the positive note, it is really exciting to work with excellent colleagues who are super committed to the patients that we serve. And so being among like-minded individuals, my fellow chairs who are taking care of their patients in their respective fields is what I really love about the job. So I think there's a lot of upsides, little downsides. Of course, we have the challenge of managing many different things at the same time. But I think that's what makes it exciting. And listen, I'm an OBGYN. I can never remove that from my identity. We're used to dealing with multiple things. We take care of two people at the same time. We're chronic multitaskers. So that's just part of the part of what I can do and what I've been called to do. So I'm excited about that. I know I'm using the word excited a lot, but I just am. So I really, it makes me happy. It's really what I was called to do, as I mentioned.
That's great to hear. That's so positive. And can you, I think, as somebody who's juggling so much, your own patients, department, I guess all these changes that are happening now around the country with Roe, can you give us a view, window into what a typical day is like in your every day for you?
I think what's quite typical is that really handling multiple things at one time, as I mentioned. It's a lot of meetings, believe it or not. It's a lot of meetings. It's a lot of collaborating with multiple different key interested parties in the hospital system. So other leaders, other heads of departments, other administrative leaders within the hospital, managing excellence in clinical care for the patients in our department. So making sure that happens with our faculty. And then, also making sure that the education of our residents and our fellows are excellent, because again, we want to encourage them to provide good quality care. So making sure we're teaching them what's standard of care approaches to the care of their patients. So it's really sort of something different every day in that way. And then I also still see patients. And so I see patients. And so managing the clinical care of my own patients are some of the things that I do on a daily basis. But it's a lot of meetings, believe it or not, merely making sure and collaborating with others and talking to others. And also, what I didn't mention before is outreaching to our community members. We work with a lot of organizations in the community. And really hearing exactly what our patients need from our community members are some other things that I do as well.
And is that, would you say, your day is like 20, 20, 20, like that have you had to decrease the amount of private, of your patients that you see as you juggle these other responsibilities?
Yeah, absolutely. I mean, I think I was doing more direct clinical care in my previous life. So the amount of direct clinical care that I do may be a little bit less. But I think the fact that I'm still seeing patients keeps me really grounded. It really helps me with my feet on the ground to be sort of frontline to go back to those analogies that they've done in the last 2.5 years. But it really helps me be connected with my patients. So I enjoy that. So I really make sure that I continue to have a relationship with my patients. I would miss that if I didn't do anything. So I really make sure that I do that in some kind of way.
And I guess one of the questions that I asked Dr. Sujana Chandrasekhar, who couldn't be here, but
Mm-hmm.
for this, I think has something with her family. But I asked her if she had any questions for you, and she said that as woman physicians, as a woman of color, that one of the things you hear is no. So
Mm-hmm.
what did you do when you've heard no? And I don't mean no like you can't go to that conference, but sort of in the
Mm-hmm.
bigger scheme of where your ambition and people saying you know
Mm-hmm.
blocking that or saying no.
Yeah, I mean, I think I've always had a perspective of myself that may be grander or bigger than what other people thought what I could do or what I was able to do. So for me, I'm used to that being potentially limited or put in a box. I don't let that stop me. I work with mentors. I speak to my mentors. I have a very supportive dean. And so I really use that energy to help me figure out how to overcome or get around any obstacles that are placed in front of me. Do I need to jump over them? Do I need to go around them? Do I need to dig a hole underneath to get around them? So I think I don't let anything really stop me from what I want to do. If I did, I definitely wouldn't be here today. So I really don't allow that to stop me. And I also hopefully give that message to my students and my residents and my fellows that I work with that, whatever it is you wish to do, finding others that can support you, even outside of where you are. I don't have that at my institution. I'm quite supported, but wherever that may be, family, it could be friends, it could be your institution, it could be your former teachers, anything that helps you, aspire to where you want to be is what you should do.
Are there any words of advice in that as you talk about that, going going past those things that you have in your head? Like I mean, I
Mhm.
spoke to somebody once and she said, she just keeps saying, what should I be saying out loud, and not in my head, sort of, are there things that you tell yourself? And that would, I'm sure we'd all love to hear that.
Yeah, I mean, I don't think I have any specific mantras on a day-to-day basis, but I think what I do is I've learned, and this could be just age, or it could be just experience or wisdom, that not being afraid to tell others what you want to do. Sometimes we're so afraid of hearing what people could say. We don't want to really reveal all that are what our dreams are, all of our ambitions to others. And so I'm a religious person. I'm not ashamed to do that. And so sometimes that inside voice is a spiritual power, a higher power, or a God, or whatever you call that person. And so that's where I've sought a lot of the strength when I've had those obstacles or people telling me to say no. And I'm not ashamed of that, which is a very important part of my life, and helps me to really move forward in the work that I do on a daily basis.
That's very powerful. That's good to know. So even though you didn't have I don't think we all have a mantra, but but a mantra, but though that believing in yourself and not being afraid to say what you want to say is really important. So I'm sure that's very important to all the doctors you're training.
And that may not have been my younger self. I mean, I think that's my more experienced, knowledgeable self. Maybe that's not what I would have said to my younger self, but I think I've always had that inner will in many ways, that's really propelled me forward when I had, challenges of schoolwork or time or et cetera. So challenging patients or just schedules. So I think that really inner voice and inner strength has been helpful for me. Not everyone has that, but really trying to find that is what I try to really speak to my students and my residents and fellows about all the time.
Thank you. It's really good to know and inspiring. I will remember that. Thank you for everyone who's joining us. I think Paula Kiger is joining us from Tallahassee, Florida. She's saying hello, and she's a member of our team at Digimentors, which has produced the She's on Call show and does the New York Times read along. So
wonderful. Greetings from Florida. Greetings to Florida.
So, in a general way, what do you think of as the most important impacts of the Supreme Court's overturn of Roe versus Wade for healthcare, for women's health care?
I mean, I think for us as OBGYNs, we've always been advocates for our patients. We've always believed in how we can ensure and make sure that our patients have access to the full breadth of medical care, reproductive care. So while it's quite disappointing to say the least, I think what it has helped us is really working with all of our colleagues in all of the specialties to really stand with us. I think there's a hashtag, We Stand Together, that really is impactful. Our internal medicine colleagues, our family medicine colleagues, our pediatric colleagues, all specialties. I think you saw online, there's about 75 specialties who joined the American College of Obstetricians and Gynecologists, ACOG, in our statement. So that is encouraging in many ways while we're dealing with really difficult situations of how to think about that and manage that. I'm encouraged by that we all are on the same page, many of us, in really trying to support, the full breadth of care for women, for patients, those with uteri, to really make sure that they're well taken care of. And so that's what we continue to battle on a daily basis. We continue to work on that.
And is that something that, you mentioned, you just had a meeting, is that something that has been, of course, stepped up, as we've, with this challenge to a woman's right to choose. And is that something you see yourself, continuing to be very active?
Yeah, I mean, I think, I'm here as an individual, but I'm a member of a medical specialty, as mentioned. So ACOG, working with, I'm also a member of the National Medical Association, which is the largest and oldest organization of Black physicians in the country. And so the president happens to be an OBGYN as well. And so I think all of us, as I mentioned, it really has us thinking about multiple different fronts. How can we support our individual physicians as they're able to figure out ways, how can they continue to care for their patients throughout wherever they're working? How can we continue to maintain that doctor-patient relationship without interference, without other interference in the care of our patients? That's super critical, so that we can take care of patients the way we know how to do. That's what we trained to do. That's what we went to school for. That's what we did our training for. So that's really, really important. So it helps us think about how we can continue to think about making sure that we continue to train the future generations, as I mentioned, to make sure that patients have access to care, where there are limitations from where they are living, how we can support continued training for physicians, not only OBGYNs, but all kinds of providers of care. So all of those things are sort of top of the mind on a daily basis, and figuring out multiple different strategies to think about those things that are very important.
Thank you. Thank you for your leadership. And for New York State, which is a safe haven, Right now, are you anticipating women from, other states traveling to New York and to SUNY downstate for care that might involve a difficult pregnancy, where they're referred, or reasons that have to do with the health of the mother, or, and the health of a fetus, for women who cannot get abortions where they live?
Yeah, we definitely have been discussing that. We definitely haven't seen that like as of today, but we're definitely armed and prepared that if we do anticipate patients traveling, or how we can work with, collaboratively to address access of care issues, we're able to do that. We provide a full range of services in obstetrics and gynecology at downstate. And so how we can really work together throughout the state, all OBGYNs and our colleagues, other colleagues throughout the state, to really make sure, again, that patients have the full access of care, to make sure that they're safe in the care that they receive, to make sure that all providers are able to care for them or refer wherever they are. That's what we're constantly thinking about, and figuring out how to do that where we live, and even in states outside of New York State as well.
And is there any training that's that you're talking about to for people outside of the, for people who may not be gynecologists, or so that they can provide either abortions or pills for abortions?
Yeah, thank you for that question, Rose. So right now, ACOG has a training program. It's called Impact. Now, we'll have to look up the exact full name of the acronym, but what it really is for is a program to increase the training opportunities for not only OBGYNs, but all other kinds of providers. So whether that's internal medicine physicians or family medicine physicians, midwives, nurse practitioners, all clinicians of all types, to be able to provide whatever services they can within their scope of practice. So medication abortion, and then obviously for OBGYNs, surgical procedures, or procedures that are important. So I think there are many opportunities for people to find out about what those programs are, to find out how to access those additional trainings if they need them. And so I think that continues to be an ongoing discussion to make sure that everyone knows about that, and how we can support them if they don't know about those resources.
That's really valuable to hear, and encouraging that there's such a coordinated, effort to try to meet the needs of women around the country.
Absolutely.
So one of the questions I love to ask, since this is such a big topic, but what issues do you think we are not hearing about enough in terms of abortion rights and restrictions, women's health in the mainstream media?
Yeah, I think some of it has been discussed, but I think it's really important for us to think about, continuing to think about and talk about access, really making sure that everyone has access to the full breadth of care, medical care, obstetrical care, gynecological care, reproductive care, without interference. You may have heard a little bit about that in the media, et cetera, and social media, but I think really having the physician-patient relationship, we talked earlier about how important that is to me. I talked to you about how, I chose my field because of that special relationship that I have with my patients for a lifetime, from they're young to all throughout their life. And so really how we can maintain that physician-patient relationship, how we can ensure we're allowed to do our full scope of practice without that interference, how we're able to, because of that, allow patients to have access to the full breadth of care, which is very important to mitigate some of the high rates that we talk about of, morbidity and mortality that we mentioned when we spoke earlier. All those things are super important. So I think we may not always connect those two things, but I think without that full access, patients, may have other outcomes that we don't anticipate from what's going on. So I think that's what we want to amplify and discuss even further.
Well, thank you. And just for readers who, or listeners when you talk about access and you talk about um, uh, mortality rates, maternal mortality rates, can you
Mhm.
speak a little about that and what you mean, what context we should think about that?
So we know that for Black women, for communities of color, because of structural inequities in society that may impact health outcomes. And so the rates are quite well publicized that Black women have 3 to 4 times, sometimes as high as 5 times, depending on where they live, the rate of dying in childbirth or within 1 year after childbirth compared to white women or their white counterparts. And so I think, again, sometimes we don't connect those dots very well, but without individuals having a full access to all the choices that they can in their life, the medical choices, the reproductive health choices that could potentially lead to these health outcomes, and especially because of those inequities that we spoke about, that can lead to, morbidity just means complications from, the time of childbirth and up to a year after childbirth. One of the things that I'd like to amplify is that ACOG continues to work on, and we've been successful, especially in New York State, on ensuring that those have insurance coverage, Medicaid insurance coverage up to 12 months after delivery of a child, after childbirth. And that's super critical to help us with that access of care that we spoke about. So that's really one of the main tenets that may not be spoke about enough. So we want to let everyone know about that.
And is that tend to be an issue for women who because of this systematic inequity, might develop complications later, or is that later in pregnant in after a birth of a child, versus a woman who might have good health insurance from an employer and gets regular checkups, or goes back after 3 months or 6 months,
Yeah, I
the birth
think I
after.
think I think what we've found is even in spite of great health insurance, even in spite of good economic backgrounds, because of those structural inequities, people still can not get the full service of care that they need to, in spite of having great insurance, in spite of having high socioeconomic backgrounds. And so I think us continuing to work on that, making sure that everyone has access regardless of their type of insurance, making sure to speak to the post-Roe world that we're living in, that everyone has access to the full breadth, every part of their care that they need throughout their lifetime. That's super important for us to really always think about.
Thank you. Thank you for your insight. Uh, One of the things that I just wanted to note about you, is that you've received numerous, medical student teaching awards from the New York Medical College Department of Obstetrics and Gynecology. In 2012, you were honored with the Association of Professors of Gynecology and Obstetrics Excellence in Teaching Award, and there are many others I won't enumerate here. But what is it about? Well, you talked about your love of teaching. Uh, but can you explain to viewers who may not realize, with the ban in 12 states now, or if it's going to be half the country at
Mhm.
some point, on abortions, how will medical students in the field get the specialty training they need? And
Sure. Thanks for that question, Rose. So I think the part where this impacts the training piece is one, in those individual areas where there are these bans or these limitations on the ability to provide full access care. We're unable to train sometimes medical students and residents and fellows in these procedures, either medical abortion or other procedures. And so that can impact, the care that people can get later on if we're limited into the locations where people are practicing. And so that again connects again to that access of care. We are already going to have a physician shortage in the next less than 10 years. And so we want everyone to be able to, again, access that full breadth of care. And if we're unable to train students and residents and fellows are people that are beyond their residency training, getting additional training, then we won't have enough providers of all types to provide that care. So sometimes we don't really get a sense to know, the full aspect of why this is limiting. And that's another way we want to talk to folks about if they're not as familiar with the impact of that to trainees.
And could that affect, as you need to get hands-on training, and if you're in a state that prohibits giving out abortion pills or abortions, and I don't know what they're going to do with ectopic pregnancies and things like that, but what specifically, what is the specialty looking at in terms of possibly doing, in light of also that there'll be a shortage of physicians?
I think that's what we were talking about in terms of the additional training opportunities that we're talking about, and making sure that individuals have additional training opportunities. And so I think that's one important way in which we're looking to address that.
Where doctors might travel to another state to get that.
Either they might travel or et cetera. And so I think, and then also advocacy. When I've talked to students, medical students are being advocates for their medical institutions to figure out how they can continue to support and advocate for their own education. So I think medical students, trainees, are really helpful in our advocacy efforts for their own education. Making sure that they know how to do everything that they went to school for, that they're in training for. So I think those are very important ways that we're working to address some of those issues.
That's great. Thank you. I guess a question I have for you is, tell us a little bit about your background and what did you want to be when you were growing up?
That's a great question. I mean, I've been inspired to enter the field of medicine since I was 15 years of age in high school. I did a program actually in high school where I was exposed to the field by taking classes at a medical school in New York City. And although I was in high school, and so I was being taught different classes like biology by medical students. And so that was so inspirational in my life, in that it made me really decide that medicine was the right field for me. And then really just pursuing that all the way, till I completed my training. So I think, really continuing to encourage young people when they have those kind of dreams, help them realize those dreams are super important.
And tell us, your mother, you mentioned she was in the medical field and exposed you.
Yes, my mother worked as a lab technologist in the field of microbiology at a hospital in the Bronx. And so, she wasn't a physician, but she really exposed me early on to the healthcare setting. And so, I wanted to help people. I didn't know exactly what that meant to help people, but I knew this was an inspirational way that I could provide help to individuals who are at their most vulnerable, right? When people are ill and people are not feeling well, and you're able to either help them or help them maintain their wellness, right? Preventing illness. Those kind of things is what really, really inspired me to really pursue medicine. And so, as an OBGYN, we work with individuals, patients who, that are healthy for a good portion of their life. And so, really how to prevent illness, prevent diseases, screen them for things such as cancers, and et cetera, making sure people have healthy diets, exercise, all those things is really what I wanted to do. So I'm so thankful for the opportunity to be able to do that.
So it's a comprehensive look at health and an ability to help
Absolutely.
people.
Absolutely.
We have a short video that a downstate SUNY downstate put out about featuring you talking in the neighborhood. So if we can show that, we'll go right ahead.
The community that I'm taking care of reflects my family members. I went into medicine to take care of underserved patients, and so that's really, why I came to downstate. I was called to do it. I really love it in every breath of my being. This is who I am, and I'm really committed to really training and teaching the next generation of obstetricians and gynecologists.
Okay. Great to see you in action a little bit, and talking to patients and teaching.
Thank you.
Tell us a little about the population that you serve at downstate.
Yes, so as mentioned, and hopefully was reflected in the small clip, we take care of primarily Afro-Caribbean population. We mentioned that there's about 2.3 million people in the borough of Brooklyn, and in central Brooklyn in particular. Almost 42% were born outside of the United States. And as I mentioned, it really reflects my own community. My parents were immigrants from the island of Jamaica, West Indies. My grandmother lived not too far from where downstate is. And so really, I feel that I'm coming home in many ways. I speak to patients that are very familiar to me in their cultural background, and the foods that they eat, and in just their health practices. And so that's what really drew me to this community. I'm able to really take care of those patients that really reflect the family that I know. And so they're family members to me, really. They're more than just patients. They're people that I really care for as a family member. So that's what I really love about working at downstate, for sure.
I'll bet you get a lot of homemade meals that people bring in. Thank you.
I look for them. Shameless plug.
Awesome. Well, hopefully anyone seeing this remembers that, any patients, colleagues. And do you see, yourself? Is this something you see yourself doing forever? That you want to do? Your life's work.
It is my life work. I intend to do this until God calls me home, so to speak. And so really is what inspires me. I continue to feel joy in it every single day. And so, and the appreciation I have from my patients, from my students, for my trainees. I just attended the graduation of my residents and my former residents. And so when I see people completing their training and going on to the next stage of their careers, it really inspires me that I've chosen the right field. I've done the right career choice in my life. And so that really inspires me to get up in the morning, for sure.
That's great. Great to hear. I love your enthusiasm.
Thanks.
And one of the things I ask my guests is, who are their own women to follow? So I will ask you that question, Dr. Clare.
So I've been super inspired by a classmate of mine from high school. We were very, very good friends, Dr. Philomena Asante. She works in Boston, and she is a pediatrician. So we're definitely joined at the cord, so to speak, right? And so she's been inspiring. She really is committed to work in public health. I also did public health, and so we are reconnected as adults. And I'm so excited to amplify the work that she's doing in the Boston area, really to make sure that she cares for the patients that she cares for in her community. And so I'm super inspired by my colleague, Dr. Philomena Asante.
And she's head of a group, Diva Docs Boston. Am I right?
Yes. So she's and she can definitely check out her webpage, her Twitter feed, as I should mention, and really really trying to amplify other women, specifically Black women in medicine in the area of Boston. And so that's really been an excellent platform to really, again, I think what's so helpful for us is to amplify each other, really support each other, and to really, like you're doing, Rose. I mean, this is such a great opportunity when you talk about women to follow. It's inspirational what you're doing. So I really thank you for the platform of thinking that what I have to say is of value to others. And so it really helps us really, make sure that, here they are in action, getting together in the Boston area and really just, again, amplifying each other, supporting each other, really supporting other women in medicine. And that's really, really key, how we can support each other to do the work we've been chosen to do.
Well, thank you. I think it's really important. One of the things, I've done is to, when I started this, is to say, who are your women to follow, is to name, that I think that, it brings attention to the positive of lifting each other up.
Mm-hmm.
And to name people that aren't as well known as, in popular culture or in politics. Because there's so many women doing such great things. And, on social media, at least, it's still very much, a man's world in terms of who amplifies what. So, this is, thank you very much for joining me.
Absolutely. I mean, it's just one example. There's so many examples. Like, it was, you asked me who to name. It was so hard to name just one, but I mean, I think your platform really just allows many people to just be brought forth. So I thank you for, again, that opportunity.
Thank you. Can you say a few words for us to encourage us, as many of us face this we've lost this constitutional right. I didn't think I would lose this, in my lifetime. I have a daughter, it was just, and never thought she would face a reversal of something that I had the right to, right?
Absolutely. Well, I mean, I think just us continuing to talk about these issues, to not sleep on when things are not going the direction that we wish. I've learned throughout my career how important advocacy is, being proactive as an advocate, not waiting for us to react to things that are happening, but how can we, continue to advocate? How can we work with others? How can we learn from the lived experiences of others? Really, that's super important. Our patients, we learn so much. I've learned so much from my patients. I'm just one vessel, so to speak, in which I do the work, and working with all my colleagues, all different types of healthcare providers in the hospital system and healthcare systems, really allows us to continue to take care of individuals when they're at their most in need and most vulnerable. So just having the humility to do so is what I'm thankful for on a daily basis.
Just from the side where I'm always a patient, what are some of the, 2 or 3 most important things, or most common things you learn in treating patients?
One, patients know their bodies and know what they're looking for and their questions. And so just being able to listen to my patients is really what I've learned. Sometimes me just pausing, really just allowing them to tell their story. I learn a lot. I learn a whole lot, as opposed to going one question after the other. But if I just listen, just allow them to listen, and myself to listen as they tell their stories, the information is there. And then if there's anything that's missing that I didn't pick up, I'll ask one of the questions. But really hearing the lived experiences of my patients, that's what I've learned the most from them, just how to hear their stories and just be willing to listen to them. That's the key.
That's great. That's really wonderful, because I think, many times I assume patients might come in with questions. People are, I don't know if you call it medical Googling or that's called, whatever that's called. But that doesn't always necessarily speak to what they're experiencing and feeling. And for a doctor, it's so important to be listened to.
I encourage that. When patients come with information that they look up, I say, let's talk about it. What did you find? I tell my patients to go back, go online. I give them trusted resources. I said, go ahead. If you have any questions, let's come back. Let's talk about it again. So thanks to Paula for the shout out from Florida. So I appreciate that. But yeah, no, that's really helpful. I encourage that. And that's important. Our patients have questions, and how can we help them get the right answers is what's important.
Yeah. No, it's really key, and it's just great to hear a doctor say that. I don't usually get a chance to ask a doctor that, so right. And I think it rang true for Paula, who said, is so a lot of O's, so true for patients to be listened to, and I guess you're talking about dialogue, so that if they do have questions, you can say, okay, well, you can go look that up, but come back to me and we'll talk about it. So. Thank you.
Wonderful.
All right, I'm just going to say a few words, and if you could just wait for me in the green room and backstage, I'll be with you in just a moment.
Thank you, Rose.
Thank you so much, Dr. Clare. Really a great pleasure and honor to hear from Dr. Clare, who's on the front lines every day, taking care of women and teaching medical students in OBGYN, the OBGYN specialty. So I really thank everybody for joining me, and hope you'll join me for my next show in a few weeks. And I'm not sure of who the guest is, but I think there is a New York Times read-along this week. Paula Kiger, who was listening before, is one of the producers. So please tune in for the next New York Times read-along show. And thank you so much for joining me. Send me any questions, and always happy to hear your own who you want to name as a woman to follow. So thank you.